Well, breast cancer awareness is just not for October, it's for all year long. We need to be aware of our bodies. We need to be rallying together to make sure that this epidemic one day is cured. And I'm here at HMG with Dr. Cheryl Stanski. Tell me why, Dr. Stanski, that I, at my age, 44, should have a mammogram.
Well, that's a great question, and there's been a lot of confusion recently about screening recommendations. They sort of change every year, and women don't know what to do.
That's true.
And there's probably not exactly a one-size-fits-all model, but in general, between 40 and 45, you want to have your first mammogram to get a good baseline, assuming you don't have any other risk factors. That does a couple things. It establishes a baseline, and it's really the most effective test to look for breast cancer. Mammogram's going to find things a lot earlier than we'll feel them. It will find them when they're very small, and we know that the smaller they are when we find them, the more success we're likely to have in treating breast cancers. And that's why we really encourage women to go. It's the best way we can look for a breast cancer.
So you start with the self-exam that was most recommended, and then from there you suggest even if you don't find something that's age-related, you need to have a breast exam done by a professional mammogram. And so after that, what's my process? Once I have the mammogram, where do I go from there? What's our next step?
Well, then you'll get your results, and that's really key. If your mammogram is normal and there's no issues, you don't have a mass, there's no changes, none of the things we would worry about, we recommend screening probably every year until you're 55. And then from there it gets a little hazy, but every year to every other year for most of your life. The older a woman gets, the more likely she is to get a breast cancer. So there isn't a certain age where we'd say, oh, you're not going to get it now.
And factors such as having it run in your family, or it can just happen to anyone, can it? It's just all women related, and you need to have this done every year.
Exactly. Most women who get breast cancer don't have any of the risk factors we ask about. So we ask about a lot of things: family history, if you had an abnormal biopsy, how old were you when you started getting your periods, things like that are all risk factors. But really, when you look at women across the board, most women who get breast cancer have none of those risk factors. And every woman's at risk, and unfortunately it's a prevalent disease. Now, on a good note, if we find these breast cancers, we have really tremendous success in treating them. So if we know about them, we can take care of them.
Early detection is the best way for a cure. Okay, I think I'm ready.
Okay.